What if the number flashing on your blood pressure monitor right now is the last warning your body will ever give you? I'm Dr. Richard Ben, and after 2 decades of standing beside patients in emergency wards, I have learned one brutal truth. People don't die because they didn't care. They die because in the most critical moment of their lives, nobody told them what to do. So right now, if your monitor is showing 180/100, stop whatever you are doing. Put everything down. This is not just a concerning number. This is your body screaming that your arteries are stretched to the absolute edge of their physical limit. Doctors have a name for this zone. They call it the zone of imminent danger. And the reason it is so terrifying is not just the number itself. It is what can happen inside your brain within the next few minutes if you do nothing, or worse, if you do the wrong thing. At 180/100, the pressure inside your arteries is strong enough to rupture a blood vessel in your brain. That rupture is called a hemorrhagic stroke. It can paralyze you permanently. It can erase your memory. It can take your ability to speak, to walk, to recognize the faces of the people you love. And here is the most chilling part. It gives you no warning, no countdown, no dramatic pain that signals what is coming. The silent killer does exactly what its name promises. Now here is what nobody tells you, and this is the part that could save your life today. Your very first instinct in this moment is almost certainly wrong. Right now, part of you wants to lie down in bed and wait for it to pass. Another part of you wants to grab your keys and race to the emergency room. Both of those reactions could make everything worse. Both could accelerate the disaster you are trying to escape. What I am about to give you is a 5-minute physiological protocol, a precise sequence of actions you can perform right now in your own living room to bring your pressure down before it becomes irreversible. This is not guesswork. This is the science of your own body working in your favor. The vascular safety position. Your body is telling you to lie flat. It is asking you to close your eyes, rest your head on a pillow, and go horizontal. Listen to me very carefully. Do not do it. That instinct, as natural as it feels, is one of the most dangerous mistakes you can make at this moment. When your blood pressure is at 180 or above, and you lie completely flat, you eliminate gravity. You remove the one physical force that was helping keep blood distributed in the lower half of your body. The moment you go horizontal, blood surges freely toward your head. Intracranial pressure spikes. You have essentially turned a manageable crisis into a more dangerous one. Think of a garden hose running at full power. Hold it upright and the water struggles to rise against gravity. Lay it flat on the ground and the water blasts forward with nothing resisting it. Your brain arteries, already under extreme pressure, become that hose on the ground the moment you lie down. What you must do instead is sit down immediately. Find a chair, a sofa, anything with a backrest. Your back should be upright or slightly reclined, somewhere between 45 and 90 degrees. Never go fully flat. Plant both feet firmly on the floor. Do not cross your legs. Do not tuck them under you. Feet flat on the ground. This position allows blood to pool safely in the veins of your legs, using gravity as a natural reservoir that draws volume away from your head. Support your head gently so your neck muscles are not straining. Relax your jaw. Relax your shoulders. You may not realize this, but ambulances never transport cardiac or stroke patients lying completely flat. They are always semi-seated. This is not for comfort. It is survival physiology. By keeping the torso elevated, you reduce the amount of blood returning to the heart with each beat, and you decrease the mechanical pressure pushing against your brain. Even a few millimeters of mercury reduction from posture alone can be the margin between a blood vessel holding and a blood vessel bursting. Sit down. Stay there. Do not move. Let gravity begin doing the work while we move to step 2. Nitric oxide breathing to shut down adrenaline. The moment you saw that number on the screen, your brain triggered a survival response. You probably didn't notice it happening, but your breathing changed. It became faster, shallower, and you started pulling air through your mouth. This is a physiological catastrophe in a moment like this. Mouth breathing during panic floods your blood with oxygen but strips out too much carbon dioxide. Low carbon dioxide causes your blood vessels to constrict even further. At the same time, your nervous system reads the shallow, rapid breathing as a signal that danger is present, and it releases a flood of adrenaline and cortisol. Your arteries stiffen, your heart pumps harder, your pressure climbs higher. You have entered a vicious cycle. You must break it. And the tool to break it is already inside your head, literally. Your sinuses produce nitric oxide, one of the most powerful natural vasodilators known to science. When you breathe through your nose, nitric oxide travels directly from your sinuses into your lungs and then into your bloodstream, where it signals your arteries to relax and expand. When you breathe through your mouth, you bypass this entirely. You lose the one chemical your body produces specifically to calm your vascular system. Close your mouth right now. Let your tongue rest gently against the roof of your mouth, just behind your upper front teeth. Now apply the 4-7-8 technique. Inhale slowly through your nose for 4 full seconds. Let your abdomen expand, not just your chest. Hold that breath for 7 seconds. Then exhale slowly through your mouth for 8 seconds, as if you are gently blowing out a single candle across the room. That long, controlled exhalation is what activates your vagus nerve, the body's own braking system. It sends a direct signal to your heart to slow down and to your arteries to loosen their grip. Repeat this cycle 4 times without stopping. Do not underestimate what you are doing. You are not just relaxing. You are using biochemistry to physically force your blood pressure lower. You are overriding a panic response with deliberate physiology, thermal diversion with a warm foot bath. While you continue breathing, we need to physically intervene in your circulation. The principle here is simple, and it is pure physics. Right now, your circulatory system has a traffic jam in its most dangerous locations, your heart and your brain. Too much blood volume is concentrated in the center of your body. We cannot remove that blood, but we can redirect it. We can open up new pathways at the periphery so that blood naturally flows outward and relieves the pressure at the top. Heat does this automatically. When you apply warmth to any part of your body, the blood vessels in that area dilate. They expand. Blood, always following the path of least resistance, flows toward the heat. This is the principle behind thermal blood diversion. You need a basin, a bucket, or your bathroom sink. Fill it with hot water, not lukewarm, genuinely hot. The target temperature is between 40 and 45 degrees Celsius, which is as hot as you can tolerate without burning. Submerge your feet. If someone is with you, ask them to place warm cloths on your hands as well. Now watch what happens inside your body. Thousands of capillaries and veins in your lower legs and feet are suddenly dilating, opening wide. Blood is flowing downward, away from your skull, toward your warm and relaxed feet. You have created what I call a secondary circulatory reservoir in your lower body. You are physically pulling pressure away from your brain using nothing more than hot water. Many patients tell me that within 5 to 10 minutes of placing their feet in a warm basin, the throbbing pain at the back of the head disappears. The visual fog begins to clear. This is not psychological. It is because blood is no longer hammering your brain vessels with the same force. The physics of pressure distribution has shifted in your favor. One critical warning. If you are diabetic or have neuropathy, reduced sensation in your feet, you may not be able to feel if the water is too hot. In that case, use a thermometer to check the temperature, or ask someone else to test it with their elbow the same way you would check bath water for a baby. A burn on top of a hypertensive crisis is the last thing you need. Keep your feet in the water for 10 to 15 minutes. If it starts cooling, add more hot water. The heat is your medicine. The hidden bridge massage, cervical release. You are now seated correctly, breathing with purpose and warming your feet. There is one more physical obstacle we need to address, and most people never think about it. Your neck. The moment you entered a state of alarm after seeing that reading, your neck muscles contracted. The sternocleidomastoid and the trapezius, 2 of the largest muscle groups in your neck, became hard and tight. You can probably feel it right now if you pay attention. That tension is not just uncomfortable. It is mechanically compressing the blood vessels that run through your neck. Your neck is the bridge between your body and your brain. Through it run the carotid arteries carrying pressurized blood upward and the jugular veins draining blood downward. When the muscles around that bridge are clenched tight, they squeeze those vessels. Blood enters under pressure but struggles to exit. The result is a pressure cooker effect inside your skull that intensifies headache and dramatically increases stroke risk. We need to open that bridge, but before you touch yourself, one very important warning. Never press on the front of your neck where you can feel your pulse. That area contains the carotid baroreceptors, pressure-sensitive nerve endings. Pressing them aggressively can cause sudden fainting or, in some people, dislodge a piece of cholesterol plaque. What we are going to do is entirely on the side of the neck, and it is gentle. Place your index and middle fingers just behind your earlobe. Feel for the small, soft groove between the base of your jaw and your skull. That is the auriculo-cervical point. Now draw your fingers slowly in a straight downward line along the side of your neck all the way to your collarbone. Always downward, never upward. We are encouraging blood to drain toward the heart, not push back toward the brain. The pressure should be light, like gently stroking a calm animal. You are not pressing deep. You are stimulating the skin and the superficial fascia to send a relaxation signal to the vagus nerve. Do this 10 times on the right side, then 10 times on the left side. Many patients report an almost immediate sensation of pressure releasing behind their ears, a slight clearing of their vision, a sense that their head feels less full. This is intracranial pressure dropping in real time as the jugular veins reopen and blood can drain freely back toward the heart. Stay calm. You have now used gravity, chemistry, heat, and mechanical decompression. Your body has everything it needs to begin regulating itself. What you must never eat or drink, the invisible danger. You have come this far. You are positioned correctly, breathing deeply, feet warm, neck released. Your body is working hard to restore balance. And this is exactly where most people make their final and most devastating mistake. Out of nervousness, out of habit, or out of ignorance, they put something into their mouth that undoes everything. There are 3 things you must never consume during a hypertensive crisis. First, caffeine in any form. Coffee, black tea, cola, energy drinks. When blood pressure is critically high, you often feel dizzy and mentally sluggish because oxygen delivery to the brain is disrupted. Your instinct says to drink something strong to feel more alert. Resist it completely. Caffeine is a powerful vasoconstrictor. You have spent the last 10 minutes forcing your arteries to dilate through breathing and warm water. 1 cup of coffee reintroduces a chemical trigger that will slam those arteries shut again. It is like pressing the accelerator and the brake simultaneously. Your pressure will rise. Second, sugar and salt in any form. Sometimes the dizziness from high blood pressure is mistaken for low blood sugar, and someone hands you a biscuit or a sweet drink. Do not eat it. A rapid sugar spike triggers an insulin response that creates systemic inflammation. If someone offers you something salty, crackers, cheese, chips, even 1 mouthful of sodium enters your bloodstream and begins retaining fluid. More fluid volume in your veins means higher pressure. Every milligram of salt at this moment is fuel for the fire you are trying to extinguish. Third, and this is the most important warning in this entire protocol, do not take aspirin. This is the advice that could be the difference between life and death. There is a widespread belief that in any cardiac or vascular emergency, chewing an aspirin is the right move. For a heart attack caused by a clot, that advice can be correct. But a hypertensive crisis at 180/100 carries a very high risk of hemorrhagic stroke, which means a blood vessel rupturing inside your brain and bleeding. If you are already experiencing a small bleed and you take aspirin, you are introducing a blood thinner that prevents clotting. What could have been a contained, survivable bleed becomes an uncontrollable hemorrhage. You could turn a scare into a fatal catastrophe. Never take aspirin during a hypertensive crisis unless a doctor has performed imaging and confirmed there is no bleeding. You cannot know from the outside which type of stroke is beginning. Do not guess. Do not experiment with your own brain. The only thing you should consume is plain water at room temperature in small, slow sips. Proper hydration supports your kidneys in filtering your blood and helps regulate viscosity. Do not gulp it. A large volume of water swallowed quickly can trigger nausea, and the pressure spike from vomiting is exactly what you are trying to prevent. Keep your stomach light. Keep your bloodstream free from external chemicals. Your body is intelligent. When you remove the obstacles, the stress, the poor posture, the stimulants, it knows how to find its way back to balance. What you have learned today is not casual medical information. It is a physiological shield that could protect you or someone you love in the worst moment of their lives. The protocol is 5 steps. Sit in the vascular safety position and let gravity work for you. Breathe through your nose using the 4-7-8 technique to shut down your stress response. Submerge your feet in warm water to redirect blood away from your brain. Release the tension in your neck using gentle downward strokes to allow blood to drain properly. And do not put anything into your body that will undo the progress your physiology is making, especially not aspirin. Seeing 180 on a blood pressure monitor can paralyze anyone with fear, but fear is only dangerous when it leads to the wrong action. You now know the right action. You have physiology on your side. You have gravity, chemistry, heat, and your own nervous system working for you. Take one more slow breath in through your nose. Hold it, and release. The power to protect your life is already inside you. I'm Dr. Richard Ben. 20 years of clinical practice have taught me that the right knowledge at the right moment is the most powerful medicine in existence. Act fast. Stay alive.